Now let's talk health. And there's this lingering question. Remember I mentioned it earlier. How does medication really work? And we're focusing on tablets, capsules, and injections. Well, to help answer this question this morning is Kenneth Etok Akpan. He is a pharmacist par excellence, I like to call him that, with over 7 years experience, ranging from clinical practice, community pharmacy practice, drug supply chain management, and, of course, digital healthcare. It's such a pleasure to have you in the studio with us today.
Again.
Fantastic. So when we talk about medication, people don't usually get it right. So I think it's best we start from you defining what medicines really are.
Yeah. So I would like to say medicines are chemical substances that are used to either treat, to prevent, to diagnose, and to cure ailments or diseases. Or we can also say medicines are substances that just promote general well-being of the body, right? So, and there are different types of medicines and different routes of administrations of medicines. So we have medicines that are administered through the oral route, that's oral medications, that's your tablets, your capsules, right, and the likes. We also have injections, it falls under the parenteral route. We also have medications that are applied on the skin, right? That's intracutaneous route of administration. We have different routes of administration of medicine. There's one that is called the intraoral, right? That's through the eyes. No, through the ears, sorry. Then the ocular is through the eyes, right? Intranasal is through the nose that goes directly to the lungs. So there are different routes of administrations of medicines, and yeah. That's for medicine.
Okay, so let's clarify now. We have capsules, we have tablets, and we have injections.
Right.
Especially between capsules and tablets. People can't tell the difference.
Yeah.
Could you enlighten us on that?
So tablets are usually in powdery form, right? They are mixtures of different chemical entities, and they are usually in powder form. While capsules are encapsulated in a gelatin capsule, right? So the powders are actually encapsulated in a capsule that could be oval, could be spherical, or in different shapes, right? So that's majorly a difference between a tablet and a capsule.
This thing you just said just reminded me of something. Someone told me that when she's giving capsules, she usually opens it. And I was stunned because I never imagined people, do that.
That's wrong.
They believe that the encapsule part is not supposed to be
it's actually,
taken.
It's actually part of the medication, right? It's supposed to be taken wholly. You're not supposed to disintegrate it before swallowing it. You're supposed to take it wholly with water, right? You're not supposed to disintegrate it, or it's very dangerous practice. Yeah.
Okay, so now let's talk about what the focus really is today. How does medication work?
Yeah, so interesting. I remember when I was younger, a lot of people used to ask me, "Oh, how do medications? You just take something for a small tablet and it cures a headache." Yeah.
Fixed.
So there are different processes by which medicines work, and there are 4 major processes, right? The first process is called the absorption of the medication. So when you take a medication through any of the routes I mentioned earlier, maybe an oral medication, you take it through the mouth. So it first of all has to be absorbed into the body, right? And when you take it through the oral medication, it goes to the stomach, right? And the enzymes in the stomach breaks it down and everything, then it goes to the liver, right? Then there's something called, the next process is called distribution, right? When the blood is the major organ, the major portal for which medicines are distributed around the body, right? Then the next process is called metabolism. Metabolism is the process by which the liver is a very important organ in medication working very well in the body.
Which is why when you abuse medication, the first organ of your body that
is affected is the liver. That's why we always tell people avoid alcohol, because alcohol always destroys the liver, right? So the liver is the primary site of metabolism of drugs, which simply means, forget the big grammar, it's just the breakdown of drugs to simpler bits which can be easily absorbed into the body. Then the next process is called excretion, where after the drug has been broken down by the liver, it's being excreted. The inactive parts of the medicines are excreted either through the urine or through feces, right? So those are the 4 major processes by which medicines work. So first of all is the absorption, then the next one is the distribution, and it's the blood that distributes the medicines around the body. Then the next one is the metabolism, which simply means just the breakdown of medicines into simpler parts, right? And this primary site for metabolism is the liver, right? That's why it's always good to avoid alcohol when taking medications.
So I have two questions,
right,
in response to what you just said, before we go to injections. The first question is this: how is it that babies cannot be given, or young children cannot be given tablets whole? Is there a reason for that, since the body can break it down? Or is it that their bodies are not able to? And the second question, so that you can be able to answer both, is is the body like a smart robot that knows exactly where to dispense a particular medication so it can work? Or does the medication work for the entire body and then the place that needs it the most then heals?
That's a very good question. So for your first question, for babies, right? Babies are more inclined. They are more inclined to take medications in syrup form, right? Because it's easy for the baby to be able to swallow it and absorb it better. For tablets, they're not. That's why it's always advisable for babies to you crush the tablets or you break it into simpler parts so that their body can absorb it. Remember, one of the processes by which medicines work is absorption, right? And for babies, you need to actually break down these medicines to very simpler bits for their bodies to absorb it.
Their liver can't do it yet.
It's not yet fully functional to be able to do it fully, right? So that's why we always say give them syrup. Syrup is so easy. And another thing is the taste of the tablets, right? For syrup, it's always coated with sugary substances for them to mask the taste of the tablets, right? So it's easy for them to take the syrup, right?
But some syrups are bitter. Why?
But for children, mostly they always mask it with either fruity flavors or strawberry or orange or something.
When I tasted one recently, I was like, what kind of wickedness is this?
Yeah, the thing about that is that there's a limit to which you can mask the tablets, right? So that's why, as much as you can, you just try to mask and just do so that you don't even lose the efficacy of the tablets.
Okay,
right?
Now the second question.
Then the second question, right? So when medicines are taken, remember I said the blood is the primary mode of transport by which medicines are distributed around the body. So there's something called the site of action of medicines in the body, and there are cells, right? There are different cells in the body. So when medicines are taken, they bind, right, to different cells in the body that need the medicine the most. So that is why pharmaceutical scientists are trying so hard to be able to make more precise medicines, because medicines, they go around the body. They go around the body. That's why they elicit side effects in different. So, for example, maybe that's why some common side effects of anti-malaria medication is headache, right? And it's supposed to treat malaria. It's supposed to eliminate malaria parasite in the liver, right? So that's why sometimes because it goes around the body, right? But the thing is, it binds to the cells that needs the medicine.
I believe that's the same thing for injections, right?
Yes,
that's the same
so for injection. So the major thing is that it goes around the body and binds to sites that need the medicine the most. So it's called this site of action.
Unfortunately, we cannot talk more about this, because I really wanted to ask some questions about injections, especially for those who, no matter what, they feel they can't get better without taking injections. But really, it's been such a pleasure having this conversation with you. I can't wait for next week's conversation. And talking about next week's conversation, somebody got married 3 weeks ago. Yeah, he's a new groom. Congratulations.
Thank you so much.
Congratulations.
Thank you.
Okay, let's see what MM is preparing for us this morning with Chef Shebi Otimo in the kitchen.